Good afternoon, everyone, and thank you for joining us for Never Say Never, the next edition of our popular virtual expedition series. My name is Carolyn Thompson, and I'm the Director of Philanthropy at the University Hospital Foundation. I would like to first acknowledge that the University Hospital Foundation is located on Treaty 6 territory, and we respect the histories, languages, and cultures of First Nations, Métis, Inuit, and all First Peoples of Canada, whose presence continue to enrich our vibrant community. As Emily mentioned, today's session is being recorded. We will send the link to everybody who responded to this invitation over the next few days. The University Hospital Foundation's signature fundraising event, the Festival of Trees, is just around the corner. Our cause for the 22 Festival of Trees, presented by Landmark Homes, is the creation of a Neuro Rehabilitation Innovation Centre at the University of Alberta Hospital. Now imagine being told you'll never walk again. Some of you with us today may have heard those words or know someone who has. Now imagine hearing that with the new Neuro Rehabilitation Innovation Centre, there's hope that your ability to walk can be restored. Amazing? Absolutely. Possible? Not without the community support. So thank you for joining us to learn more about neurorehabilitation and the role that your support of the 2022 Festival of Trees will play in making the new Neuro Rehabilitation Innovation Centre at the University of Alberta Hospital happen. Now, please submit any questions that may arise during today's presentation through the Q&A button at the bottom of your screen. We will attempt to answer as many of your questions as possible during the Q&A session, which will follow Dr. Ho's presentation. Now, I have a question for you. What brought you here today? Please participate in our live survey by selecting the one answer that best represents why you decided to join us for today's expedition.
The results are coming in. We will give everyone about 10 more seconds.
Okay, well, as always, we certainly do have a cross-representation of those that have joined us, and we see there's a large number of people who are just interested in learning about this research. I'm very happy to see that we have some students and researchers with us as well. And then we do have a few people here that have certainly experienced spinal cord injury. So thank you so much for participating in the survey. And regardless of the reason that brought you here today, we're so very glad you are here. As I mentioned earlier, our virtual expedition today is called Never Say Never. Now, I think you can say that about a lot of things in life, but today we're focusing on something that is very easy to take for granted, and that's about our ability to walk. And you know, it's not just about walking, it's your ability to stand independently, to move our feet and bend our knees. To lose your mobility in the blink of an eye would be devastating. But thanks to the bold and courageous visionaries like Dr. Chester Ho, who will be joining us shortly, there is a reason why we are saying never say never. By supporting the work of innovators like Dr. Ho, we see ourselves as agents of hope at the University Hospital Foundation. And if you decide to support this initiative, then you will be agents of hope as well. Thanks to the generosity of our donors and corporate sponsors, in the last decade decade, we have raised nearly $220 million in support of advanced medical care in our communities. Through strategic partnerships with government and industry, we are igniting research and innovation that may have impact around the world, beginning right here at the University of Alberta Hospital. And now, to guide us through the next step of this exciting expedition, I would like to introduce one of our very own bold and courageous leaders, our Chief Financial Officer, Roseanne Carey. Roseanne?
Thank you, Carolyn, and good afternoon, everyone. In a moment, we are going to hear from Dr. Ho about why we need a Neuro Rehabilitation Innovation Centre at the University of Alberta Hospital from the perspectives of medical care and research. But there's another perspective that I'm going to share with you today, the human side, and how dramatically our lives can change in the blink of an eye. Bill Stevenson is a husband, father, musician, painter, you name it, and he's probably done it. He also loves to fly. In August of 2021, the single-engine plane that Bill was piloting experienced engine failure just after takeoff. Instead of soaring to the sky, his plane crashed to the ground. The impact shattered his spine. Following hours of emergency surgery, Bill asked his doctor if he would ever walk again. His doctor shook his head and said nothing. For Bill, his wife Rhoda, and their young family, the news was devastating. Then Bill met Dr. Chester Ho, who disagreed with that assessment. He told Bill that possibly, with the right rehabilitation, he could walk again. And as you may have guessed, Dr. Ho was right. Within a year of his accident, Bill was standing on his own, playing the piano, and walking without a cane. While his recovery is miraculous, he did not have to rely on a miracle for it to happen. What worked for Bill was rehabilitation. But not every patient responds the same as he did. Riccardo Baldini is a young graduate student at the University of Alberta and a classically trained pianist from Italy who was paralyzed when a congenital malformation of blood vessels ruptured in his spinal cord. One day, Riccardo was building a greenhouse in his backyard with a few friends. The next morning, he couldn't move his left leg. No one knew about the malformation in his spine until it ruptured, and by then it was too late. Riccardo now lives his life in a wheelchair. His zest for life has not diminished, and his journey through rehabilitation is not yet over, but his prognosis is different than Bill's. And then there is Jan Fletcher, who had planned to spend her day cleaning the stable when a friend invited her out for a trail ride. A lover of horses from the time she was 4 years old, Jan happily accepted the invitation. She and her horse Wager were on one of their favorite trails at Elk Island National Park when Wager was spooked by a bison. Galloping at up to 40 kilometers an hour and heading for home, Jan knew that the upcoming turn could be deadly for both of them. In a desperate bid to save herself and her horse, Jan executed a safety maneuver she had done countless times and jumped off Wager. But this time, instead of rolling on the grass and hopping to her feet, she shattered her spine. Incredibly, Jan can now ride her horse again, but she has not yet recovered her ability to walk. Will she ever be able to walk again? Will Riccardo regain the ability to work the foot pedals on the piano? The best that we can do for all these patients, and so many more, is to give them the best chance possible to recover. To tell us more about the role of neurorehabilitation and how the new Neuro Rehabilitation Innovation Centre will change and enrich lives, I would now like to introduce our special guest. Dr. Chester Ho is a practicing physiatrist and the Senior Medical Director for AHS Neurosciences in the Rehabilitation and Vision Strategic Clinical Network. He is also a professor and spinal cord injury research chair at the University of Alberta. Dr. Ho, we are so happy to have you with us today. The virtual floor is yours.
I'm just really honored and privileged to be here today to share my passion, and that's about neuro rehabilitation. And in particular, I'll talk to you about the proposal to have the Neuro Rehabilitation Innovation Centre to be built at the University of Alberta Hospital. And so I'm going to talk about why it is important to think about neuro rehabilitation, and also what is the Neuro Rehabilitation Innovation Centre at the University of Alberta Hospital, and also what potential impact this may bring to our community. So first of all, why neuro rehabilitation? Well, I don't know if you realize, but neurologic conditions are the leading causes of disability in Canada. And so what do I mean by neurological conditions? I'm talking about things like spinal cord injury, stroke, Parkinson's disease, multiple sclerosis, etc. And these conditions can lead to gradual or sudden loss of function. And they include, but not limited to, things like paralysis. What do I mean by that? I'm talking about loss of movements in the arms or legs. So imagine suddenly from the spinal cord injury that you had from a car accident, you became paralyzed in the legs. You just lost the ability to walk completely. And you can have a stroke, and then it leads to a loss of function in the arms. So you can no longer write, you can no longer drive a vehicle. You may actually lose sensation. And so you feel numb in your hands, in your arms, in your legs, in your body. And imagine how you can use your hands or not if you don't have sensation there anymore. And also, you may even lose control for your bowel and bladder, something that many of us take for granted. Now, suddenly, the control's gone. And so you may be incontinent. That's really quite devastating. So you can imagine that when you get to the hospital after a neurological injury, such as spinal cord injury and stroke, you basically will receive the best treatments now by your neurologist or by your neurosurgeon at the hospital. And so you've received the surgery, you've received the medications for your stroke and for your neurological conditions, but what's next? You're still not able to move your arms or to use your arms. You're still not able to move your legs or to stand or to walk, and you're still incontinent. So what can we do? That's where rehabilitation comes in. So at this time, the professionals for rehabilitation will help you to regain function. So if we look at the current research, we know that early rehabilitation may improve people's recovery after a neurological injury. And if we look at the current healthcare system organization and infrastructure, it may not actually allow for optimal timing and access to early intensive rehabilitation. Now, while most neurological recovery may occur in the first few months after an injury, but the focus on rehabilitation right now is actually in the rehabilitation hospital. So it may take some time for you to get there. So you can see that there is a potential mismatch between what I would call the golden hour for your recovery and also when your rehabilitation may be delivered. So if we think about it, the University of Alberta Hospital is the main tertiary care hospital for many neurological conditions in northern Alberta. And right now, rehabilitation is available at the U of A hospital, and yet is limited by these items: space, equipment, and staffing. We do have some wonderful rehab staff, but they are really limited by, as I mentioned, space and equipment. Now, if we look at the research side of things, the University of Alberta actually has some of Canada's strongest neurological rehab research programs with internationally renowned researchers. And if we look at what rehab research can do, it includes novel treatments and also interventions that may improve neurological recovery. So if we can integrate neurological rehabilitation research at the hospitals early after a neurological injury, that may actually potentially lead to better outcomes and also recovery. But with the ways that we do things right now, are we really maximizing the functional recovery potential of patients with neurological injuries? I'm not so sure that we are. Now, here I'm showing some pictures of Bill that Roseanne referred to earlier. So on the left-hand side, there was Bill actually in the hospital, and then he was going through rehab in the center. And now on the right-hand side, you can still see that Bill was actually recovering so much that he was doing rehab with stairs. So that's really amazing. But are we really giving this opportunity to everybody? And so given that we know that there's a gap there, we have a goal to maximize an individual's recovery potential and functional abilities after neurological injuries through early rehabilitation treatments and research. And that's actually why we wanted to introduce the concept of the Neuro Rehabilitation Innovation Centre. So by building a Neuro Rehabilitation Innovation Centre on the 5th floor of the University of Alberta Hospital, we want to provide the space and also equipment for rehab professionals to work with rehab researchers to implement state-of-the-art treatments to patients early after their neurological injuries. Now, in terms of space, we are looking at a renovated gym that includes an integrated neuro rehab research and treatment area, and also an electrophysiology research suite that will help us to measure the outcomes with state-of-the-art equipment. And in terms of rehab equipment, we're hoping to equip the space with state-of-the-art rehab equipment that's at the forefront of technology, and that's currently not available in our hospitals. And so with this concept, it will be the first in Canada to integrate translational rehab research into acute care hospital, allowing patients, clinicians, and researchers to work together in the same space. Now, that's a really novel concept because oftentimes right now we have researchers working in their own space and clinicians and patients working in a separate space. But with this concept, we want to bring everybody together so that the researchers can learn from the patients and also from clinicians to understand what's important to them and also what research may benefit directly our patients and clinicians. And similarly, clinicians and patients can learn directly from our researchers what they're working on and what potentially can benefit their recovery and treatments. And so with this in mind, we want to then provide adult acute care neuro patients with early access to specialized intensive sensory motor rehab. And that will also strengthen the U of A hospital's capacity and ability to carry out world-class rehabilitation research. And keeping in mind that right now, the research is often done in the lab space at the university, that we want to bring it all onto the hospital's site so that we can do the research where the patients are. So how do we do that? Well, we want to actually do some major renovations on the 5th floor of the U of A hospital to create space that's appropriate for research and clinical training. You may wonder why the 5th floor. That's actually the space that will be the home of the neuroscience programs, including the brand new neuro ICU that's in the works. And so it will be clearly aligned, and also it'll be right next to these important patient care areas where rehab will benefit them. And this center will provide space to promote collaboration between patients, clinicians, and researchers to perform research studies and to generate new ideas. And it will allow us access to innovative rehab equipment, innovations, and technology that currently our patients and also clinicians are not really able to access. And also, we want to build in some state-of-the-art measurement as well, such as electrophysiology, that will help us measure how the nervous system is recovering. And we'll also make sure that we'll provide clinicians training to use the innovative equipment. So basically, with this Neuro Rehab Innovation Centers, we envision that we'll have integration of rehab research and clinical treatment. There will also be that really amazing space that will be state-of-the-art for rehab research, and also will be improving our patients' satisfaction, outcome, and recovery. And the center will also clearly align with our neuro-intensive care development. So now I just want to get into some of these areas in a bit more details. So in terms of state-of-the-art rehab research space, I mentioned about an electrophysiology research suite that will be headed up by Dr. Monica Gorsini, who's a neuroscientist and a professor at the University of Alberta. And Dr. Gorsini is my collaborator in this work. And as you see here, this is Jan, who Roseanne introduced earlier. And we see here Dirk, our research associate, and also Jess, our PhD student of Dr. Gorsini. They are actually measuring the nerve transmission of Jan during her study. And so with this, right now it's done in the lab space, but with the Neuro Rehab Innovation Centre, it will be done in the hospital, which is really amazing. Now, I talked about this space a lot already in terms of the renovation, and I'm so excited to show you some architectural drawings here because it's not just all talk. Already, with the support of the hospital leadership and also the foundation, we already have actually identified space on the 5th floor at the hospital. You see on the left-hand side is actually the blueprint of some existing offices and also gym space. That's all shaded. But you see that a large number of different areas will actually undergo renovation to create a really open and large space. That's actually shown on the right-hand side. And that will be on the 5th floor of the U of A hospital. And that will be the site where we envision the Neuro Rehab Innovation Centre to be. So you see that that requires a lot of renovations. And in terms of equipment that will be there, I'm showing you here a list of different state-of-the-art equipment that will be purchasing for this space. Now, that includes lower extremity restoration and gait training with functional electrical stimulation cycle, and also wearable robotic exoskeleton, and also the zero-G gait and balance system and overhead seating track to allow people to have the ability to walk without the fear of falling, and also partial body weight support devices and therapeutic electrical stimulation. And similarly, for the upper extremity, we want to have some state-of-the-art equipment, such as wearable robotic exoskeleton and also FES or functional electrical stimulation devices. Now here, on the left-hand side, it shows Bill again. And so it's Bill basically on the FES bike or the functional electrical stimulation bike. I'll tell you more about Bill's journey later on. But basically, that will be in the Neuro Rehabilitation Innovation Centre. Right now, that's actually my lab space at the university. But with this Neuro Rehab Innovation Centre, this will all be at the hospital. Now, I just want to show you one example of what what one of the equipment may look like. So this is the Exobionics wearable robotic exoskeleton that we will be purchasing for this Neuro Rehab Innovation Centre. And this is produced by the company. And we have selected this product because basically it's approved by Health Canada for rehab use. And but I just want to make sure that there's no, I have no financial interest with this company. So for the next couple of minutes, I just want to show you a number of people with neurological injuries who basically use this device to help them regain their walking abilities.
Don't tell me no, because I'm going to figure out a way.
The exobionics has given me back hope in my life. I was able to stand up and walk for the very first time. The greatest feeling in the world.
The first time I walked in EXO, I was walking completely different, and I never went back to walking the way I was before.
I went from being completely assisted as I walk around with the walker to walking around by myself. I don't feel like having this challenge in my life should be something that holds me back.
I want to see what EXO has in store for me, because it can just happen just like that, something come right back. If there is a chance, I would never give up.
Before my injury, I was extremely active. I played tennis 3 times a week. I golfed every Sunday. And so for 2.5 years, that was taken away from me. So EXO has completely brought me back to life. The first session, I learned my balance. Around session 5, I learned to use my calves again. Session 20, I was walking unassisted. And by session 36,
Okay, I apologize. Let me just go to the next slide. I think that it just stopped abruptly, but it's okay, we can move on. And I just want to make sure that you're seeing the full screen right now.
Yes, everything looks good.
Okay, thank you. So you see that from that video, basically, they were people with spinal injury and also stroke, etc., and brain injury as well. So they lost the ability to walk, but with that exoskeleton, many of them actually regained some ability to walk, which was really wonderful. And imagine if we actually can do the same here at the U of A hospital. That's what we want to do. So just to bring home the point here a little bit, I just want to go through Bill's story again. So I met Bill in the ICU in 2021, just days after his plane crash. Now, he had a severe spinal injury and was paralyzed from the waist down. His medical team did not think that he could walk again. And so I saw Bill for my rehabilitation consult. And after I examined Bill, I thought that actually he had the potential to walk again. And yet, it just looks like, not so sure, because his legs were completely paralyzed. And yet I got signs and that he could walk from my assessment. And so I thought, you know what, let's actually go all out to see how we can help Bill to regain the ability, because we need to have hope. We need to really do everything that we can when we actually identify some possibility. And so basically I thought, you know what, right now we don't actually have this in our treatment, but we actually have functional electrical stimulation cycling as my research program at the U of A hospital. And so I thought, let's actually enroll Bill into our program. And so Bill agreed, and Bill thought, okay, let's just go for it. And so he started the assessment for our program. And I think that initially, right, it was like, okay, let's just try, but he wasn't quite so sure. But after listening to Bill, he thought that during Dr. Gorsini's electrophysiology assessment, when she actually used magnetic energy to stimulate his brain to see if there's actually a connection in the peripheral nerves, Bill's toe started to move. That showed that there was actually still the connection between his brain and also the leg. So when he saw that, he thought, oh my goodness, I might walk again. I think that if I understood correctly from Bill, that's actually the aha moment when he thought that he really could do it. And so from that time on, we just enrolled Bill into the program. and he was doing the FES cycling 3 times a week for several months. And then guess what? Bill started to regain strength in his legs. And then, bit by bit, he started to stand. And then, months later, within 1 year, he started to walk. First of all, with a walker, and then with a cane. And now he is able to walk without a cane. So, really, right? Never say never. So, with the Neuro Rehab Innovation Centre, what's the potential impact? Now, from a patient standpoint, Bill enrolled in a research study that provided him with a rehab intervention early after his injury. It was something that wasn't a standard clinical treatment, but as a result, he surprised everybody with amazing recovery. Now, with the Neuro Rehab Innovation Centre, we'll be able to introduce and trial more state-of-the-art rehab treatments earlier, and potentially turning them into standard clinical practice that we don't do right now. We hope to help more people recover from their devastating neurological injuries, as well as Bill did. From a research standpoint, there will be some impact as well. We'll have the ability to study the effects of rehab treatments and innovations applied early after neurological injuries, leading to new knowledge and understanding of how rehab may affect recovery. We will have unique infrastructure to attract more rehab researchers to conduct study at the U of A Hospital. And the collaboration of researchers, clinicians, and patients will lead to more meaningful, patient-centered research in neurorehabilitation. As I mentioned earlier, a lot of research is done actually in a lab setting and also typically for people with chronic injuries. But right now, we have this opportunity to actually build this right at the hospital where patients are, and also to conduct studies very early on after injuries, which is not just unique in Edmonton or Alberta, it's unique in Canada and also in North America. So I just wanted to acknowledge all of the funding agencies who have been so instrumental in supporting our work here. And a special thank you to the Spinal Cord Injury Treatment Center Society that's led by Louise Miller, because Louise has been such a believer of this work, and she's been instrumental in actually bringing me up from Calgary to Edmonton. And so thank you, Louise. And I also want to thank my amazing team from my lab, and also my collaborators, especially Professor Monica Gorosini, who's been supporting this work from the get-go. Thank you so much. And also, I want to thank the University of Alberta Hospital leadership team as well, to Kathy Osborne, Amanda Foster, and also Emma Treadwell, because without their support, we really would never be able to imagine how we can combine research into clinical practice. And I just want to finish by sharing you this quote here from my colleague: ICU saves lives, but rehab saves quality of life, which I think is so important. And I also want to acknowledge Ricardo here. As Roseanne said, Ricardo was actually a student at the U of A with a spinal cord injury. Ricardo participated in my research project. And guess what? Ricardo is now actually supporting our research by guiding us with research project study development. And she's also supporting our research by participating in different research projects, and also by telling others about the research as well. So we're really grateful for his support. Thanks very much.
Thank you very much, Dr. Ho, for that incredible presentation. Like everyone here, I'm looking forward to hearing more from you during our question and answer period. My name is Owais Hikmet. I'm a member of the development team at the University Hospital Foundation and tonight's moderator for the question and answer period for this expedition. Everyone in the audience, you can submit your questions by clicking on the question and answer button at the bottom, the Q&A button at the bottom of your screen. And we have received several questions already, so we'll get started. Dr. Ho, the first question we have is, why is it so important that neurorehabilitation begins so soon after surgery?
Sure. And that was a great question, because after a neurological injury, we know that the recovery occurs at the fastest rate during the first 3 months or so. And so if we don't take advantage of that time, the recovery may be slower. So let's say if somebody had surgery for the neurological injury, if we actually take advantage of that time when they have the best possibility for recovery and apply rehab treatments or research treatments at that time, we can potentially really improve their recovery. And so we want to take advantage of that, what called the golden moment, golden hour, golden 3 months for recovery, so that they can actually have the best possible outcomes.
Wonderful, thank you very much. We have a few questions coming in, so that's great. The first question, or the second question I have here by Kat is, can foot due to falling that would have been impacted be cured? What is the kind of rehabilitation for the situation, and how long to reverse
Thank you for that question. I think, first of all, we probably need to look at some specific details for such a condition, because everybody is quite different. And but I can tell you that, depending on the situation and also depending on the severity of the injury, there may be different treatments. And sometimes the treatments may be a matter of compensating what we have lost. But sometimes the treatments may actually be reversing the condition. So it just depends on the situation. And I think that we need to, first of all, do that really good assessment. And that's why I brought up earlier, such as the importance of doing something like electrophysiology that Professor Gorsini does, because it's state-of-the-art assessment for us to really understand the extent of the injury and how we can actually address it.
No, thank you very much for that. We have another question here. What would be the capacity of this rehab center? How many patients could this accommodate?
Now, I think this is probably a difficult question, because I think it depends on what kind of programs we'll be looking at. At this time, we are still trying to build up the programs. And now, if we first of all, we are looking at this time mostly people in the hospital setting as inpatients, because we want to really look at the capacity carefully, so that we know that we can build this up gradually. So it's not like we open the door and then there will be a manageable requests or the demands. We want to really make sure that it's done right. And so we start off with inpatient setting, and also learn from, because it's such a new concept, we really haven't done this before between the clinicians and patients and also researchers. So we want to make sure that we get this right and then build this up gradually, so that we actually can expand this. And so I apologize that I don't really have a clear answer right now, but I think that we'll be learning a lot more about this. Thank you.
For sure. Thank you very much for that. Okay, so I have a question's a bit lengthy, but I think it's an important one. So Karen asks, is there any chance your center will be able to support a previous patient of the U of A with TBI and can walk now a little, but held back by torticollis and a plate in the neck? I learned to walk with the help of the ESK, then walker, but have been limited due to my neck having a fused plate on C6 and 7 with torticollis.
Yeah, thank you, Karen, for that question. And so I want to emphasize that for this center, we are focusing on people with new injuries, new neurological system injuries, and so they're in the hospital. But the good news is that actually for people who've had chronic injuries for the nervous system, such as somebody with traumatic brain injury in the past, and if we want to look at how to treat torticollis and other related conditions, actually there are rehab resources in the existing system. For instance, at the Glenrose Rehab Hospital, we have actually a program for traumatic brain injury. And so the wonderful thing is that we have a lot of programs like that along the continuum, but we really want to build up the acute care capacity for this because we don't have that right now. But yeah, Karen, I think that it would be really important to make sure that this individual can be assessed in the right setting, in the outpatient, through existing programs, and certainly that can be possible.
Wonderful. Thank you very much. We have Rosalie asking, what can you say about the neural losses with Parkinson's and recent research?
And thank you for that question. Now, I'm just wondering if, Rosalie, you can clarify for me, when you meant neural losses, do you mean like nerve, loss of the nerves, or loss of neurologic ability to do function, or I'm just wondering if you're referring to more the nerve cells or the function, but certainly in terms of loss of function, that's what I focus on as a rehab specialist. And there is more research about that. Now, my focus is not on Parkinson's research, but at the same time, I do understand that things like music therapy can help with movement. And so certainly, those are things that are ongoing and can be done, again, in the outpatient setting. Not necessarily what we are focusing on, in the Neuro Rehab Innovation Centre for people with acute injuries.
Wonderful, thank you. We'll keep an eye on if she asks a question. So Guy here asks, will the Neuro Research Innovation Centre replace the Glenrose, or would there be a collaboration?
No, not at all. That's a great question because basically this does not replace anything. This is actually in addition to what we do, because we have a wonderful resource here in Edmonton or Northern Alberta, and that is the Glenrose Rehab Hospital. And it provides really great rehab. But at the same time, we know that right now, oftentimes, right, on average, people don't get to the Glenrose until about 25 days after the injury. And so there are lots of reasons for that, right? Sometimes they're just not medically stable, not ready to go to rehab because of other complications, or they may actually require some more investigations in the acute care hospital, such as UFA hospital, right? And sometimes there's no bed capacity. And so what we're trying to do is to make sure that people get a head start in their rehab. Because if we have to wait until several weeks or a month or more after the injury until they get to the Glenrose to start rehab, as I mentioned before, that may be a bit of a missed opportunity, because the first few months may be the best time for recovery. So what we're trying to do here is really to start the rehab early in the hospital here in acute care. But not only that, but to allow rehab research to be integrated, which is super novel, because no one else is doing this in Canada. And so we want to be the first to do that. And we also want to make sure that apart from doing the rehab, we want to do the best rehab and the most innovative as well.
Wonderful. Thank you very much, Dr. Ho. A few more questions we have as well. So why is it so rare to have a neuro rehab center in an acute care hospital?
Sorry, can you just repeat that question, please?
For sure, yes. Why is it so rare to have a neuro rehab center in an acute care hospital?
Sure. I think that if we want to look at a neuro rehab center in an acute care hospital, first of all, there are two aspects to that. In terms of rehab, I think that traditionally, the focus of acute care hospital is really to focus on the acute medical problems. I think that the recognition of rehabilitation is gaining more and more of the focus. And so people recognize that, you know what, it's not just about saving the lives at that time. It's also about saving the quality of life, right? By doing the rehab earlier. So I think that's one component. But in terms of doing rehab research in the acute care hospital, I think it's a really good question, because most of the rehab research is done for people with chronic injuries, many months or a year out of their injury. That's because I think that historically speaking, a lot of the rehab researchers recruit from the community when people are medically stable. And when you think about it, recruiting for rehab research in the acute care hospital is very difficult. People may be medically compromised, maybe quite sick. And so how do you do that? So the really wonderful thing that we're trying to do is to bridge that gap, because on our team, we have researchers who are also clinicians who actually can bridge that gap, can deal with the acute medical problems, so that we can actually do the research on these individuals who actually can be still medically quite complex. So I think for these two main reasons, sorry, it's a long-winded answer, but I think it's an important one. For these reasons, it's been very difficult to implement research, neuro rehab and also neuro rehab research in the acute care hospital.
Wonderful. Thank you very much. We have a nice comment here. I would like to actually, it passed, no worries. So another question here by Robert. Can you speak anything to ataxia patients? I guess, would they be able to enter this rehab center as well, or would there be some support?
Yeah, thank you. I think that, Robert, thank you. For people with ataxia, there could be many causes for that. And again, it depends on the situation. And if the ataxia, is something that we're treating right now in the hospital setting, in the acute care setting, that could be something that we can look into with this Neuro Rehab Innovation Centre. But if it's actually ataxia that is an ongoing condition, there are existing resources, again, in the community, such as the rehab programs in the community or the rehab hospital outpatient clinics that can deal with that. So it just depends on the type of setting one is in, so that we can look at the right resources.
Wonderful. Thank you very much. Another question we have is, what other motor functions are restored through rehabilitation besides walking?
Oh, absolutely. I think that there are so many different motor functions that we can look at. Walking is just one of them. Imagine after a stroke, you lose the function of your arm, your hand. And that's something that we want to really look at. And of course, there's research done, there's rehab done for that already, but there's also, lots of rehab research that is looking at how we can do more about that early on. And so I think that that's just another example, but of course, there are also other things as well. Look at motor function of the diaphragm. The diaphragm is a major muscle for breathing. We can be looking at that as part of motor function for rehab research as well.
Wonderful. Thank you very much. We have a question from Lara. Could FND patients be treated in that neuro rehab as well?
Yeah.
FND?
Lara, if I may just ask you to help me out here to just spell out FND for me, that would be great, because I'm not a neurologist, and so some of the conditions and acronyms I may not be familiar with. So I would appreciate you spelling that out completely.
We'll look out for that. No worries. Thank you. Another question we have. Does neurorehabilitation benefit all brain and spinal cord patients, or just the ones with certain conditions?
So if I understand correctly, the question is, would this actually benefit all patients with brain injury and also spinal cord injury. I think that basically there is rehab that can be appropriate for different levels of rehabilitation that can be applicable or appropriate for different people. And so I would say that we can actually think about rehab for almost everybody. But at the same time, is it going to be, the most state-of-the-art rehab that is appropriate, or actually very simple rehab that we can do? I think we have to look at that individually. And so I think that it's difficult to give a very sort of generic answer to this. We have to look at each case individually. But I would have to say that as a rehab clinician, I find that there's always hope and there's always something that we can do for everybody.
Wonderful. Thank you very much. So Dr. Ho, FND is functional neurological disorder.
Oh, okay. Thank you. Thanks for that clarification. I think that it depends on the impairment there. And so, again, we have to individualize some, the approach and see if that could be possible as well.
Okay. Wonderful. I guess this will be our final question for the night. By Kamira. What would happen if a patient goes to the Royal Alexandria Hospital rather than the University of Alberta Hospital? Once the new center is in place, would patients not get the same level of acute rehabilitation, or would there be a collaboration there as well?
Yeah, I think that that's a great question. And right now, for the Neuro Rehabilitation Innovation Centre, the focus is at the University of Alberta Hospital. But there's actually a much bigger plan. And the much bigger plan is actually through a research grant that Dr. Gorossini and myself have submitted to the Canada gosh, I've lost the word. Canada Foundation for Innovation. I beg your pardon. And so the CFI grant is a $10 million grant that Dr. Gorossini and myself actually submitted earlier this year, so that we actually can do something similar to different facilities across the city. And so with that, we'll be able to hopefully do something similar in different hospitals. But for this particular opportunity, is focusing on the U of A hospital.
Wonderful. Well, thank you so much, Dr. Ho, and thank you everyone for attending today. That is all the time we have for the questions. I will now turn back to my colleague, Carolyn, for closing comments.
Well, thank you so much, Oais. And wow, what a journey we've been on today. And thank you, Dr. Ho, for your very passionate answers to our audience's questions. I hope you have all found this as fascinating as we have. On behalf of the University Hospital Foundation, including Roseanne, Oais, Emily, and myself, and of course our very special guest, Dr. Chester Ho, thank you for your time and your active participation. Within the next few days, we will send you a recording of today's expedition, and please do feel free to share this with your friends and family. And if you do want to learn more about us, please reach out by email or visit our website, which is give2uhf.ca. You can also watch recordings from our past virtual expeditions on the University Hospital Foundation's YouTube channel. Our next virtual expedition will be held during Heart Month and will take place on February 8th, 2023. So please circle the date on that calendar and you won't want to miss it. As we mentioned earlier, ongoing community support is vital to ensuring the work of innovators like Dr. Ho so that they can continue to make these amazing breakthroughs, advance patient care, and improve health in the communities we serve and around the world. Thank you so much for joining us today. And to conclude, we leave you with a short video entitled Ignite 2030. Thank you, everyone, and have a lovely evening. Bye-bye.